Hello, everyone, and welcome. My name is Amelia Martinez, and I will be discussing medical family therapy, what it is, how it came about, and its importance within our healthcare system. It is also vital to understand the roles and responsibilities that medical family therapists entail in their systemic approach to individuals and families who require our care. My goal today is to provide you with a thorough and clear understanding of the theory and the application of medical family therapy and how it can be added within your healthcare setting. Before I begin, I would like for you to think of a time when a close family member was diagnosed with an illness, for instance, maybe diabetes, cancer, heart disease, or something serious. How did you feel? How were you able to process this? And how did your family process this? Did you talk together about it openly, or did each person cope in their own way? These difficult experiences highlight that illness never just affects the patient, but those around them. The illness and treatment affects the whole family system, which ultimately affects dynamics and relationships. Medical family therapists focus on not only the individual in terms of their health and in healthcare, but also involving the family as well. While utilizing a family systems perspective, we focus on the interactions of family members and providing appropriate interventions that can emphasize a more holistic approach to care. Professionals within this field have defined medical therapy as, and I quote, an approach to healthcare sourced from a biopsychosocial, spiritual perspective in marriage and family therapy, but also informed by systems theory. The practice of medical family therapy spans a variety of clinical settings with a strong focus on the relationships of the patient and the collaboration between and among healthcare providers and the patient. Medical family therapists are endorsers of patient and family agency and facilitators of healthy workplace dynamics. The evolution of medical family therapy started in the 1980s, which was a result of many negative factors, such as, and I quote again, fragmented system of healthcare, a disconnection between behavioral health and medical providers, separation of the treatment of the mind from the body, and extraction of the patient from the family community. The integration of family therapy within healthcare was necessary and has been an effective model, noting the particular skills and applications to individuals with difficult illnesses. Core principles of the field include systemic thinking, putting emphasis on the individual, family and healthcare setting interaction, and how everything affects one another. And also collaborative care as medical family therapists work with other members of the healthcare field to provide adequate holistic care. Implementation of medical family therapy within any healthcare setting such as your own would benefit in a way where collaboration is key. It would be helpful to understand it through a four-world view, which includes a clinical, operational, financial, and training viewpoint of healthcare. Created by clinical psychologist C.J. Peek, the four-world view discusses how these four embodiments of a clinic intersect with one another, not take precedence over each other for the benefit of a well-working system. In response to an efficient system would be higher rates of quality reported from patients as well as cost efficiency for the hospital. And here we could break it down. In a clinical aspect, we look at quality and elegance from healthcare professionals, collaborating with one another in hopes to lessen patient wait time and creating fewer steps to care. In an operational aspect, we focus on efficiency in facility, seeing what workflows work to give the best care, such as avoiding redundant documentation and screenings. This allows each healthcare professional working with the patient to allow access to notes, share, and collaborate on treatment plans effectively. In a financial aspect, we look for price and value, seeing what is cost efficient within the hospital, how we can provide adequate care without it hurting the business. And finally, with an individual training aspect, we look at real-world core competencies. This fourth world is an addition to C.J. Peek's original idea, as it is important to note the significant contribution of education within a healthcare setting. With these four worlds, implementing medical family therapy can contribute to more efficient care within a healthcare setting, avoiding long wait times, lessening the need for referrals, and while also being mindful of being cost efficient for the hospital. Now let me start to give you an example of the process of how medical family therapists can be implemented in clients' care while also collaborating with other professionals to deliver concise treatment. Let me start by explaining some scales that would necessitate a call for a medical family therapist. Medical family therapists utilize different arrays of screenings, such as the PHQ-9 and the GAD-7. The Patient Health Questionnaire, or the PHQ-9, is a 9-question survey that assesses for depression. Each question has a 0 to 3 scoring, ranging from not at all to nearly every day. Adding the total number would determine the depression severity. 0 to 4 is minimal, 5 to 9 mild, 10 to 14 moderate, 15 to 19 moderately severe, and 20 to 27 severe. This questionnaire is usually self-reported but should also be followed up by clinicians. It is also efficient as it also has been proven to be effective and brief. Another common screening tool that's utilized by medical family therapists is the Generalized Anxiety Disorder Scale 7, or the GAD-7. This tool screens for anxiety and has 7 questions which has the same scoring as the PHQ-9, which is the 0 to 3 scoring, ranging from not at all to nearly every day. Scoring would entail 0 to 4 no significant anxiety, 5 to 9 mild anxiety, 10 to 14 moderate anxiety, and 15 to 21 severe anxiety. This is also seen to be a brief effective tool at determining anxiety symptoms which are prominent in our general population. So, involvement of the medical family therapist would mean implementing a primary care behavioral health model, which would include behavioral health providers such as medical family therapists being contacted by a primary care provider or a PCP regarding a patient who has screened positive for mild to severe depression and/or anxiety from the scales. These scales should be provided within an intake session with their primary care provider and would necessitate follow-up if necessary. When the PCP calls for the medical family therapy for assistance, the exchange of information typically happens outside of the exam room. The medical family therapist will collaborate with the primary care provider regarding their findings. In serious cases, it would be beneficial to also have the PCP alongside the medical family therapist to talk to the family and the patient. Having a medical family therapist readily available to primary care providers eliminates the need for a separate psychotherapy appointment. This integrated approach allows for the development of a shared treatment plan, enhancing collaboration, saving time for both patients and providers, and reducing overall healthcare costs. Here, we see the clinical, operational, and financial worlds of an integrated healthcare system. With a positive screening from the scales, medical family therapists are brought in to do an assessment based on the biopsychosocial spiritual lens and how each of these factors may relate to their current health situation. It should be noted that there are no specific psychotherapy theories that a medical family therapist would pursue. Instead, the focus would be to strengthen family communication and adaptation to a serious illness. Follow-up appointments should be considered with a positive screen, which would also entail a follow-up on the appropriate scale that had garnered a positive response. With a follow-up appointment, one intervention that has deemed helpful in assessing a patient would be to incorporate a genogram to help understand the systemic viewpoint of the family. Utilizing a genogram, seeing previous healthcare issues, as well as thoughts and emotions towards them would help benefit an approach to systemic care for the patient. Also, the medical family therapist advocates for the client and the family in regards to their health care to help them understand and respond to the illness that has taken over. Medical family therapists, in a way, are now an additional resource in hardships related to healthcare. Medical family therapists also provide psychoeducation for their clients, helping clients and their families understand the illness, possible treatments, and the outcomes if they do and do not adhere to the treatment plan should be discussed. Asking appropriate questions should be detailed in the treatment plan to help the client pursue effective planning for their health. A question like, what kind of mindset would be good to help you move forward with this change would be beneficial. Insight is important in one's health and emotions. In terms of social location factors, these should always be considered, when working with diverse clients. Understanding cultural beliefs and expectations, as well as financial barriers, should be considered when assessing a patient. Perhaps their culture does not believe in mental health care. Cultural sensitivity should be practiced to provide careful psychoeducation to not offend anyone's beliefs. In a medical family therapy role, it is important to indicate the differences between individual and family treatment plans. It's also important to note the two goals of medical family therapists: to promote agency and communion. We promote agency by allowing our clients to be active in their role with their health. They should be allowed to make their own choices regarding their treatment and care. We also help them see past the difficulties of diagnosis and set goals for one's wanted plan. This could mean for the client to set boundaries when warranted. Medical family therapists also promote communion, or the feeling of being loved and supported by family, friends, and healthcare professionals. Communion is typically affected when an individual is diagnosed with a debilitating or serious illness. Family members may not know how to cope or support that individual, and maybe the individual may not know how to ask for that support as well. The importance of interpersonal connections highlights the need for medical family therapists to help navigate both the client and the family to face the illness together. For an individual treatment plan, this may include psychoeducation, as well as learning coping skills on dealing with the depression or anxiety symptoms that have been exacerbated with a diagnosis of a serious illness. Asking personal questions of barriers from adhering to treatment could also be discussed. For instance, if a patient is stating that they are not able to quit smoking, being curious would be helpful, such as asking, "What is stopping you? Have you tried to quit before, and what worked before?" We want to focus on medical adherence because if it's not being met, they can ultimately get worse. For our family treatment plan, we also focus on psychoeducation, but also promote communication amongst the family. Having the family understand the difficulties that the client is facing is helpful so they can help support them wholeheartedly. A strong social support has been seen as helpful when it comes to individuals facing serious illnesses such as cancer or even cigarette smoking. We also want to focus on the new family dynamics. What has changed? Is someone taking the role of caretaker? How is that affecting you and the other family members? Discussing these hard questions is a necessary component in promoting communion with our clients and their families. It is necessary to comprise both individual and family treatment simultaneously to promote the best outcome. Now that you know the importance of a medical family therapist and its role in a healthcare setting, an implementation plan should be created. Utilizing CJ Peek's 4-world view, we would need to have a mindset of collaboration in mind. Trainings of each world should be provided to all staff so they are equally informed. It should be noted that a person hired within one world would be an expert within that role, but still be aware of the role of other worlds as well. This shift does not happen overnight. Implementation can start small, such as beginning with a select number of patients to treat with this model. From there, we would be able to see what works as well as what doesn't work and allow staff to get comfortable with the change in a different healthcare approach. From there, we can start implementing more cases until full integration is met. So in conclusion, implementing an integrated healthcare model involving a medical family therapist within your hospital would be beneficial on a clinical, operational, and financial domain. Involving families in the care of an individual facing a serious health condition is essential as it strengthens communication, brings support, and gives better outcomes to treatment. By approaching care in a systemic lens, we can promote healing and sustainable care. Thank you for listening and for your interest in how medical family therapy can make a difference in patient care.